The findings from the Global Burden of Disease study in 2019, published in The Lancet, showed that mild and moderate hearing loss accounted for the vast majority of hearing losses of all cases worldwide, shown here as millions of cases. This study in the British Medical Journal looked at the prevalence of different configurations of hearing loss as cases per 1,000 births. As you can see, moderate, which also includes mild hearing losses, accounts for the vast majority of hearing loss in children as well. It is interesting to note the increase in prevalence of these mild and moderate hearing losses as age increases, and this is something we will consider later on. The prevalence and configuration of hearing losses is easy to define, but something that is slightly more difficult to define in mild and moderate cases is the impact of that hearing loss on the children that have that hearing loss. In 2001, Briscoe et al. Said that findings suggest major problems in non-word repetition and phonological impairment occurred in children with mild to moderate sensorineural hearing loss. That is to say that children with mild to moderate hearing loss found it difficult to accurately repeat sounds when they were not associated with real words. In 2015, Wheeler et al. Said of mild to moderate hearing loss, although traditionally not thought to be problematic, it is becoming better recognised as a source of speech-language delay. And in 2021, the World Health Organization said that mild or moderate unilateral hearing losses, which are commonly overlooked, have an adverse impact on speech and language development in children. These might be relatively intuitive impacts of hearing loss, mild to moderate hearing loss in children. But what is less obvious is the impact that actually has on the children's educational life. In 1998, Bennett et al. Studied the impact of minimal sensorineural hearing loss on school retention rates. This is to say that children with mild or minimal sensorineural hearing loss are held back a grade or a school year at a much higher rate than their normal hearing peers. You can see here that in the third grade, 30% of children with minimal sensorineural hearing loss were held back. That increases to over 35% in the 6th grade and over 45% in the 9th grade. This is particularly impactful, especially when we consider this statement from that paper. Despite the fact that the older children in the study demonstrated a normal aptitude for educational performance, they still experienced difficulty in school. So this says that although these children were learning at the correct rate, there were also additional challenges that they were facing, which led to them being held back a grade or a year at school. Tharp in 2008 sought to understand this further by looking at a series of different studies. Here we can see the early academic findings on children with permanent unilateral hearing loss, considering whether the children failed one or more grades or school years, or if they needed additional resource help. This table also combines those rates so that you can have a broader view of the challenges faced by children with unilateral hearing loss. So the impacts of mild to moderate and unilateral hearing loss on children are quite clear in terms of their educational outcomes. But what is less clear is the reasons or the etiology for this hearing loss. In 2008, Tharp and Douglas looked at a broad range of studies to see the etiological or frequency of occurrence of mild bilateral hearing loss and unilateral hearing loss in children. You can see here there are a vast array of causes discussed, with the particular etiological and prevalence data also discussed. I would draw particular attention to genetic causes and the congenital cytomegalovirus. So with all that in mind, we will be discussing 5 key areas. The first is how can we efficiently diagnose mild to moderate sensorineural hearing losses. The second is how can we use masking to give accurate electrophysiological thresholds in unilateral cases. Then we will consider whether we should fit hearing aids to mild losses. Next, we will consider the best method to verify any amplification we give, and we will finish with looking at other systems and technologies to improve signal-to-noise ratio.